Sounds good. Absolutely. Welcome, everyone. My name is Casey Hahn, and I am a faith leader here in Renton, and privileged to just be just a part of this time and this really critical conversation that we have. There are 23 of us here, and hopefully we'll have a few more that will join us, and hopefully this will be one of many more conversations that we can have. Thank you on a short notice to come on this beautiful Saturday to gather together. Just want to provide a little bit of background. Last week, Dr. Linda Smith, the CEO of the Renton Chamber, the Chamber of Commerce, Diane Dobson, and the president of the Rotary Club, Linda Foley, and myself started a conversation about the Deintensification facility at the Red Lion and the dynamics of the proposed ordinance by the city of Renton and how that might impact the emergency shelter. In our discussion, we discovered not only a range of misinformation surrounding the facility and the ordinance, but also that each one of us had a myriad of questions and also a desire to brainstorm for ways of addressing the various needs around the Red Lion, but also the pressing concerns for homelessness in the city of Renton. We are Renton residents and work in Renton with a deep care for people experiencing homelessness and also people who work, live, and own businesses in Renton. The issue before us and the issues before us are complex, and we need brave, courageous conversation that moves us past polarization to community-based solutions. Dr. Linda Smith, Diane Dobson, and myself, and others on the call today have been advocating around issues of homelessness in the city of Renton for many years. We have partnered and continue to partner with the city of Renton, and we're grateful for their efforts. Today, we want to do 4 things. First, provide an overview of the proposed ordinance. The second is to discuss the complexity of the issue. The third is to provide each of you with time to share your own perspective in some breakout rooms. And the fourth is to finally plant a visionary seed of how we might be able to move forward. We are going to be recording this whole conversation. And again, thank you so much for being here. Really, really grateful. I'd like to turn over our time to Diane, who will give an overview of the ordinance.
Thanks so much, Casey. So I am Diane Dobson. As Casey mentioned, I'm the CEO with the Renton Chamber of Commerce. And so I come today on behalf of the Chamber to provide a safe space and neutral platform for the community to come together and have a safe conversation about issues, again, provide around the Deintensification facility, the ordinance, and a look forward as for our community. It's very important to point out to those that are in attendance today that we are recording this conversation, and we're doing so not just for historical purposes, but also to provide the same to elected officials and to city representatives so they can hear the voices of the individuals that are here today. And specifically, it is important because while this was a quick turnaround conversation, it was planned on short notice. People have a myriad of reasons as why they could not participate today, whether it be personal schedules or pre-commitments, but also there are a couple of very large barriers for elected officials to participate, that being the Open Public Meetings Forum, and there are very strict guidelines with which elected officials can or should participate in conversations that are about a specific subject matter, as well as there is pending litigation that is going on, which then further complicates the matter on the utmost of levels. And so that in mind, we won't have the elected officials here for active engagement and conversation, but rest assured that our conversations today and the voices will be forwarded to them. And we have heard from them as well. And this is a subject matter that is very important to them, and it will be received with the utmost concern and attention there too. So what we wanted to do today is really do an overview of the ordinance that has been presented. What has happened? So I'm going to go back to the beginning a bit with the approach. There's a deintensification facility that I presume we're all familiar with that has been put in at the site of the Red Lion. And this was based upon, on March 31st, the King County Health Officer issued a local health order, which authorized King County to use legally available resources to de-intensify or reduce the density of existing homelessness shelters and encampments in response to the COVID pandemic. And as a result, many locations or congregate shelters were put into an indisputable, valuable opportunity, if you will, into the hotels that were available to separate individuals experiencing homelessness, to slow the spread of the virus. And so that was a health approach based upon an emergency. And the Red Lion facility has had a number of residents there, approximately 235 individuals that are from a compilation of shelters in the Seattle area that are operated by DESC, which is the Downtown Emergency Service Center. And they are contracted by King County to operate these shelters. The challenge that the city has faced is that the area that the Red Lion is in is, and please know, I do not speak on behalf of the city. I speak with a layman's interpretation of the ordinance and the information that I have received. So where the shelter is located is zoned specifically for a hotel use. It is not zoned for a shelter of this sort. However, the ordinance that is in place, one of the big challenges that we have seen within the community that we wanted to draw attention to was the misinformation that the ordinance that's being presented is to kick out the individuals experiencing homelessness in the middle of winter or in the middle of the pandemic. The ordinance itself actually presents a viable alternative to where the shelter is currently at. It is not zoned for this operation, nor does it have a business permit for the same. So it is essentially illegally operating. But in light of the emergency pandemic, the city felt it appropriate to extend the opportunity through ordinance that the shelter continue its operations as is into June 2021, at which time there is opportunity to extend the ordinance, but the shelter would need to reduce the capacity of individuals from the 235 down to 100 in capacity. And that number from 100 may have been adjusted with the new ordinance that's been presented. I've read this same, but I haven't had confirmation from the city to the same. So that number may have been adjusted to 125, but please know when I say it may be 100, it may be 125. So the ordinance that's being presented is a temporary emergency ordinance, which means it would stay in place for approximately 6 months. The ordinance, as rewritten, and it was recently published for the agenda as recently as last night, has been modified from the ordinance that was presented last week. And what is notable about the new presented ordinance is that the city has listened to the voice of the community thus far in providing the opportunity for their staff and instruction to the staff to work with our local resource providers and our inclusion task force to look at the ordinance with an equity lens, as well as a lens of what is truly needed based upon the needs within our community as well moving forward, as we recognize the fact that homelessness is an issue within our community. It is a regional issue, and it is very different in each community. So the needs in Renton may be different than the needs in Bellevue, maybe be different than the needs in Auburn. And it is very important that we as a community look at the needs and how we are addressing those needs unique to Renton. So the ordinance itself has been presented. They had public hearing on the matter at the time. The council felt it important enough to hear from the general public subsequent, and they extended the opportunity for written communication and input to that ordinance until December 1st at 5 p.m. And they utilized that input to move forward with the new proposed ordinance. The first reading will be on Monday night, which is why we felt it important to gather everybody here today with a community conversation. And then the second reading would be then scheduled for the 14th of December. So this is our opportunity to come together to discuss the ordinance. One of the things that is important to recognize is that the city has tried to, while it is no doubt that the COVID, and this is my opinion, it is no doubt that the deintensification facility has a very valid and real need and opportunity, and there is likely little question that it has provided a safe and secure opportunity for those individuals seeking salvation at that location to have a sense of stability and security as though they may have not had in the recent past, if ever. That's something that can't be ignored. But what also can't be ignored is the fact there is very, very tangible impact upon the community and the businesses surrounding the community and the resources within our community. The calls for service, the fire violations. We've seen an escalated number of fire-related response calls, or I say escalated, maybe not numbers because the numbers were grand before, but the incidents themselves have definitely seen an increase with a fire, and our businesses surrounding the area as they are struggling with just the economic impact of COVID itself. Have tangible and documented costs and expenses as well. So we need to be respectful of the fact that these businesses are in a location that they never anticipated this type of service being there. It is not zoned for the same, and they had no reason to anticipate it. And so working together, the city has been creative to try to work together to come up with a solution that is going to best serve the community in a safe and legal fashion, if you will. So our hope today is to what we're looking at doing is breaking out into, actually, this is where I would turn over to Dr. Linda.
Great. Thank you, Diane, and thank you for that overview again.
Dr. Linda, before you get started, what I want to point out is this is work that Pastor Casey and Dr. Linda have been doing in our community for years. And so their response to this ordinance and approach is not a trigger. It is not something that they are responding to now. Dr. Linda was instrumental in the Center of Hope, which was a women's and children's homeless shelter that was located in our city hall that received its first guests in May of 2013. And so she has been truly invested heart and soul into this work and with the work she does on behalf of our community. And so before you get started, I want to thank you for your continued advocacy for our community, as well as the vulnerable that you serve.
Well, thank you. So you did the introduction. So again, as Diane said, we're here because there's an opportunity for collaboration and community-based solution. So again, Diane mentioned, the Reach Center of Hope is currently serving, families in our community. And that's really just one part of the population of those who are experiencing homelessness in our community. And as she also stated, that Pastor Casey, Han and I began about 2.5 years ago creating what we call the Vision of Hope. And that's a resource center where we were servicing those who were homeless, not providing housing, but the mental health service, the addiction services. And so that was very, very powerful. And COVID, sort of put a stop on that, but we're going to resume that. So, so the question for us is, and what I've been, this whole time is, what are we doing for the homeless population here in the city of Renton? Can we absorb these additional 230 people and address the existing need of our community? So we know that the Intensification Center was brought in for COVID-19. However, the county always talks about the regional approach. Well, Renton hasn't been included in that regional approach. So, I believe, my heart and soul is in making sure that every person that's experiencing homelessness have a safe place to sleep. And so we've missed that here. We are seeking, and we are just really seeking a city and regional approach. And Renton needs have not been addressed, and that is the unfortunate part of this. I've had conversation with individuals. We still see tents going up in our cities and parks where people are experiencing homelessness, and yet the center, and I'm not trying to disparage that because I understand why it was put in, and I appreciate that. But we still have needs here that are not being met. So our coming together today is really to, hear the voices of our community, to talk about this and how do we move forward, as a city, and making sure that the people here in the city of Renton needs are being met and addressed. Thank you.
Thanks, everyone. It's a great deal. I have a lot of excitement and a great deal of respect for everybody gathered at this table today. I know some of you by name, some of you I know by reputation, but what I know about all of you is that you are committed to putting our heads together and seeing what we can do to find creative ways to have our whole project move forward. Our project being, as Linda just said, that every place is there a place, and everywhere there is a place for everyone to have a home. So as we engage in a conversation, I have this little palindrome, a ROSI. What is the ROSI? Well, the ROSI is, it goes like this. R stands for respect. We will all be obviously respectful as we share in conversation, but most of all, we want everyone to have an experience where you are you. You can express quite clearly what it is and what you bring to the table in a true and authentic way. And you're considerate of one another. That goes without saying. We all here are always considerate of one another. It's a real stretch for us sometimes to be open to new ideas, to ideas that jar us a little, that we're not used to. So we're going to all stretch to do that. We want to hear from you why this meeting is of interest to you, why you came. And we know that when you tell us why you came, there may be some things that are upsetting. What we're asking is, as you look at what's upsetting or what's different or what brought you here, which may not always be so rosy, will you also explore with us what you think might be a response to that which wasn't rosy and why you came? In other words, together, the collective energy at this table can think about ways we can move forward. So as we break out into small conversational groups, sort of like a Foursquare community, we can share with one another, who are we by name? Why did we come? Particularly, what do we want city and county staff and elected officials to know about this situation? I think the most exciting question for me is, do you think there's an opportunity in this situation where county has come in and city has to absorb, and how can two groups bring about a model? Is there an opportunity here? That's an open question. What issues do you think the ordinance will address? And while they address some issues right now and they move forward, and there's a date in June and there's another date in January of 2021, what do you think the implications are for the future? That's really what we're doing here. We're mining for gold for the future and how we can have input to that future. So as we leave today, I think we might all come away with an internal next steps. We have a tremendous opportunity to have a collaboration, city and county. Each of us as residents and concerned individuals have an opportunity to say, we see some ideas that we think could bring service and place together, and we are just offering these up. So we are ready. If there are questions, let's entertain them, and if not, let's all join in a smaller conversation to answer those questions. I think we're going to be.
Yeah, I see there's one hand raised. Jeremy, did you have a question before we head to the breakout session?
Jeremy, you have to get unmuted.
Oh, sorry. Not necessarily a question, more so some concerns about what's going on. My husband was actually working at the Red Lion as a security officer, so yeah, lots of concerns about what's going on. Yeah.
Great.
So
and Jeremy,
oh, go ahead.
Yeah, Jeremy, we'd love for you to share that in that breakout room. So I'm glad that you're here, that you can share that.
And then that's what I think I kind of prematurely raised my hand. Then I heard that you guys, oh yeah, that's the breakout. So I think I kind of prematurely raised my hand. That's kind of why I stopped myself.
We're glad you're so eager. Great, it's perfect. So I think Ashley's gonna split us up into some groups, okay?
Yes.
Oh, I should have introduced, I apologize. As we split into groups, there'll be a person who can help facilitate the conversation in each group. Diane will have a group, Maggie will have a group, David will have a group, Casey will have a group, Linda Smith will have a group. Did I miss anyone? We'll have 6 groups. I apologize, I should have got that out faster. I'm thrilled that we can be facilitated by such agile and nimble people.
Yeah. And you know, Linda, as we head into the breakout rooms and Ashley does that division, I want to again remind everybody that if there is a lack of presence of elected officials here, it is not because this matter is not important to them. It is because of the maybe conflicts with schedules, but also more pressing is their limitations based on the Open Public Meetings Act, as well as the pending litigation that's there. I also want to jump in. I failed on my coverage of the ordinance. I talked about the one bullet point of people are not being evicted now. It is the ordinance. What it does is there are a couple bullet points that I skipped over, and if you'll provide me the opportunity to cover them. The ordinance allows immediate legal relief to the DESC operations at the Renton Red Lion property, which is currently operating illegally at the site because of no business license and the zoning restrictions. It also responds to the urgent needs associated more generally with homelessness by allowing new homeless shelters to be situated in the city under a permit process. The ordinance does not require DESC residents to be evicted. The ordinance provides King County and DESC significantly additional time to relocate the shelter to a lawful location. The ordinance does not prohibit the Renton Red Lion Hotel or any other hotel from renting individual rooms for more than 30 days or accepting vouchers for homeless residents to stay at a hotel. The ordinance does not prohibit new homeless shelters. It explicitly allows them subject to permit. and the ordinance does not prevent coordination with homeless service providers and does not make unlawful any existing lawful operations. For example, that cold weather shelter. So those are all items that have come up in questions that have been concerns about the ordinance placed before. So before we head into the breakout rooms, I wanted to make sure to bring those forward.
Thank you, Diane. Those are especially pertinent. I think that, again, that the fact we have an ordinance and that it's already shown revisions and it speaks to including the voice of service providers lets us know that we are in a very pivotal and positive place.
Okay. And I will, let's see. I see your note there, Ash.
We're about to be
Is it giving you a notice that you're moving?
oh,
Not yet.
well,
It's here, my current charge.
looks like we're about to be.
Did it give you a notice that you're going to be moved?
No.
You know, while the breakout room dilemma is being addressed, I see a note here from Leo Floor. Leo, thank you so very much for joining us from King County today. Hi, thank you. First of all, thank you from the most sincere, genuine place that I can say thanks from for showing up. That is first and foremost the most important part of any conversation. I don't know if you would like the opportunity to introduce yourself and share who you are or where you're from. Since you were kind of the resident expert at for the Red Lion or the shelter would be fantastic.
Thank you, Diane. I'd be happy to real quick while we're working on breakout rooms. So good morning or good afternoon now. My name is Leo Floor, and I work for King County as the director for the Department of Community and Human Services. And so within our department, we do oversee the affordable housing, homelessness, behavioral health, youth programs, veterans programs, senior programs for a lot of the balance of the county. And am part of the decision making around, I'm not an elected official, but am part of the decision making and recommendation around how we ended up with the deintensification and the isolation and quarantine sites that we have across the county. And I'm happy to be here and to listen and to contribute where I can. And just really want to echo what I've heard from everybody here this morning, which is the county is absolutely interested in being part of region-wide solution for this large issue of homelessness that we have every reason to believe is actually getting worse right now and is going to get much worse next year. A lot of folks on here know that we think that we have something around 50,000 people who are at least 3 months behind on their rent across King County right now. And we have every reason to believe that we are going to have thousands more people facing eviction at some point next year. And so us getting good solutions in place and good relationships in place is going to be really critical, as we solve a problem that I think is about to get much, much bigger than it is right now. And I also just want to, hear and acknowledge, we are talking about a particular facility that's cited for COVID reasons during the period of the COVID emergency. It's had effects on the community. I think, we've heard that and we are aware and are always interested in figuring out what more we can do to help mitigate those effects. And it's had, as folks have said here, really life-saving effects for the people who are staying there. And we can compare it to other facilities where we've not been able to bring people in the rate of illness of what we know is, for many people, a fatal illness has been demonstrably lower. And so I just want to be here, listen, try to find solutions. And I thank you for the invitation, and I'm really glad to be here.
Thank you. First of all, again, thank you for being here. Thank you for sharing of yourself. And thank you for filling our time as we are ready now to get that breakout room sent. So thanks for being a part of the team, Leah.
Leah.
And okay, it looks like we're clear to go. So everyone should be sent to a breakout room.
Would all the facilitators remember, we're going to regroup when we're through, and we're going to look for the highlights that center around why people came, but the major opportunities they see and the major things that they think we can think about as next steps. So keep that in mind as we come back together, and know that your voices will be heard, and help your facilitators make sure the nexus of your voices in those small groups comes to the bigger picture. Tally ho. That's what we thought. As I was wrapping up with our group to see if I understood our group correctly, we came right here. So here we all are. What I would like to see us do, if we can do it, let me apologize in the beginning by saying we will not be able to capture all of the robustness of everything you did. That's just not possible with the time we have. But what we can do is listen carefully to the major concepts that each group arrived at, and how those would be brought to people who can do something with them. So in each group, if the facilitator could give us a really quick capsule of what was the most compelling reasons for why the people were in your group, if you could tell us that, and if you could tell us quickly what were some of the opportunities they isolated. And I think the third thing for this would be, did they come up with some ideas that address some of the concerns they had? I know our group did, and I'll do us at the end. So Casey's nodding, so that means Casey's group is going to go first because I saw her nodding.
Okay. Just briefly, really thankful for the conversation and the honesty that was shared in the group that I was with. Everyone came because they were concerned for businesses in the area, and two of the individuals, their businesses are directly impacted, and the stories were very animated. And just yesterday, last night, a car was stolen from one of the businesses, and there have been assaults to some of the employees, and so I have captured all of those stories, and I will make sure that they are shared. So yes, because of livelihood and physical safety was the reason why people came to voice their concerns. The things that were kind of lifted up as opportunity was to really beg the question if this is the right location. And sure, these are great services, but here in this location, is it the best? And is it best to have 230 people all condensed in one place? And the big questions that came about were a sense of what interplay is there with the city, because we have found Renton to be a place where we roll up our sleeves and we get down and we want to serve the community, but many lifted up that actually it doesn't feel safe at this time to do that, and there haven't been opportunities to actually engage in that way. But also the deeper opportunity was what an articulation of what is the continuum of care, and what are the steps to actually even move people out of homelessness, and what are is just parking them in a hotel room the end result, or what are the deeper ways in which people would come to restoration or to deeper health? And the two major areas that were lifted up of needs or opportunities that could be were around mental health, that many of the residents are in need of mental health or drug rehabilitation were the two big issues that were lifted up, and wanting to see if services, much more services, could be provided. The other thing that was lifted up too was a deep desire to make sure that there is an accountability for whatever way that the county is coming in, that there would be deep relationship as well as conversation, and that for a city that does care about how people moving on a continuum of care are cared for, that there would be some level of conversation, communication, and some levels of accountability, and what that would look like.
Thank you. And I apologize again in advance for the amount of time we have. I thank you. You lifted up wonderful things. I can see where we'll just fold in right at the end, our group. I'm going to go over to Maggie.
Hi there. Thanks for the chance to report back. I'll be as quick as I can. We had a wonderful group, wonderful conversation. People were there to learn, I think, in our group, to really try and understand more deeply what the complexities are. There was an articulation that there seems to be quite a bit that we don't know about the level of services that are at the DESC shelter. There was some concern over, or a comment about kind of conflicting reports about how well or how poorly services are offered. And we had the insight of Leo in our group, and he was able to note from the King County side that it would seem that both of those realities are true, that people are speaking from what they actually know, but the level of collaboration and understand to be true. And so as a group, I think we got to where the level of collaboration, we want it to be much deeper. And in fact, there was a great report of an outreach from a member of DESC who went to visit with the local business community and how that was well received. And so it seemed that there's opportunity there for much deeper collaboration. We're not sure what that looks like given the emergency situation, but that was one of the themes. Like Casey's group, a high concern and desire to respond to the need for mental health care and what on earth that looks like, a recognition that that's a hugely complex area, but it's not working. So what does it look like, and how can Renton be a part of that and addressing that issue? A desire from everybody for Renton to participate. This was not that Renton does not want to be a part of the solution, but what does it look like to really be involved? I think those were the main things. We have a lot of material which I will type up and send to you, but I hope that reflected. If anybody in my group, if I didn't get it, please message me and I'll make sure I get it.
Note takers are going to be real busy beavers. I'm going to move around. Thank you so much, Maggie. David, where is David? I'm looking for David. I see David.
There I am.
All right, David.
Yeah, we had a really great group. Everyone, a lot of people who are longtime members of Renton who are just champions of those experiencing homelessness and are doing a lot. We were really kind of blessed to have Chris with us, who is among the firefighters union. And so his perspective as a care service provider was really helpful for us. But again, a lot of citizens who are residents who are just really, appreciative for one of the conversation, just to host a place to come and to share and to come together out of concern and the benefit and the blessing of we want to help. And so the communication issue was big for us, getting clarity. So a lot of misinformation people are noting is out there in terms of, I heard that this shelter is going to get shut down. Wait a minute, now it's 6 months. Is it for sure? Is it not? So even, it was hard for us to actually answer the question of implications because we weren't even clear on communication and what the information is. So what is the platform to actually getting information out there for people, especially with the Renton reporter not available? There was also communication information, but there's also this notion of trust that is a recognition that locally within Renton residents are really responsive. But in terms of the county, there's this feeling that was noted of a lack of trust from the county, who just dumped all this stuff on Renton, and now we're the ones who have to pay for it. So the fact that there's this open possibility of coming together and having a collaborative conversation amongst a lot of different layers of leadership, from residents to elected officials to from city to county, I think that would be recognized as a big benefit. Again, I also will type up my notes, but it was a generative, appreciative conversation, I think.
I love that, the generative. Thank you so much, because it certainly is. I'm creating a grid for all of these to come back together. I'm looking, thank you, David, and your group. I'm looking for Dr. Linda.
Here I am. I'm here.
Okay.
Okay. So our
There you are. I see you now.
Yeah. So our group, as I've heard from other groups, concerned about the community, businesses, but also concerned about the issue of homelessness in our community. We had issues from internal concerns about the internal concerns of the operation of the business and its outpouring into the community. There's a concern, a perception that the downtown area was targeted. So the burden on the community and homeowners in that area experience a financial impact. There was also talk about the accountability piece of, how do you hold not only the residents, but also the impact of those who are, controlling the facility or managing the facility, I should say. One of the concerns was that for the Deintensification Center is that the homeless in our community did not have access to that. So, or as readily as others, because the people were brought in to the facility. So it seems like there was no concern or nothing really taken into consideration when it came to those in our facility. So some of the, I think, good things that really came out of it is that we know that homelessness is a national problem. And we heard I don't know if that was the chief of the fire department, talked about potentially 50,000 people becoming homeless as a result of COVID-19. And we're certainly going to be impacted by that. So they saw that small facilities addressing holistic needs throughout the city, as opposed to, planting everyone in one community, which would have a greater impact. There's also the perception, I want to go back to this, don't want to leave this out, that those who are less affluent have been targeted. In other words, the communities that are not as affluent as a Bellevue or Mercer Island was not targeted for a de-intensification center. And I just think people perceptions, it's important for people's perceptions to be lifted up. I think rights services, they really talked about rights services, and there was also the equity in the placement of the de-intensification center was concerned, and an exit plan. And really addressing the homeless situation in a way that's holistic. So,
thank you so much, Dr. Smith. Thank you. I'm beginning to see the common threads. It'll make my full wrap up easier. All right, Miss Diane, all eyes are on you.
I wasn't muting when I was typing so loud. I'm so sorry. I ended up not with a group. Poor breakout. So please defer to you.
Okay, then have I missed anyone? It's our group's turn. If I haven't missed.
Nope, it's your turn.
Okay, our group is a real interesting group. We came with some 29 years of experience down to 1 year of experience as Rentonites. We represented business as well as personal concern. The people in this group all came out of a deep desire to address the issues of homelessness. There was a real concern that people who are experiencing homelessness are people. And there was a concern that these humans are not made to feel other. And the central theme was that when you have the density we do, you're not able to serve. So we focused a lot in this group on moving forward in ideas. And the ideas that came out were, if you can work with smaller groups, you can achieve more. Mental health is a primary issue. One of our business leaders talked about job training and how she's taken on 4 new people in her response to provide more stability for people who were at risk for homelessness. A sense of community. How do you create, even in a large facility, smaller pods so that you have a sense of responsibility to a community and a community's responsibility to absorb its citizens? And what was really astounding in our group was the use of data. And somebody made a student among us, made a tremendous observation. And in this flow of services that was talked about in this small group, one of the first things that was said, it was almost as if they were starting to look at the steps for putting a plan together. And a nurse said, one of the first things we need to do is have a community meeting much like this one and talk about fear reduction. And one of the ways you can reduce fear is to listen. And sometimes you can offer up examples that might say, is the fear really based on reality? What factoids might we offer? And a student offered that last year in April, in the city of Seattle, the same population created 133 911 calls. That same population now living in Renton, April of 2020, only created 33 calls, 911 calls. I hope I've expressed this adequately. The point here being, this population was responsible for creating calls to 911. Assuming only 3 or 4 are not part of that same population, but when that whole population was moved due to COVID, that same population has generated 33 calls. In other words, from the perspective of Renton, that's far more calls than we usually have, yet looking at it from the bleacher seats, that's a huge reduction in calls that this population has generated. As I use my listening ear to think about all that has been said today, it's clear that accountability is needed so that business is safe, and that's one of the major concepts we'll move forward. It's also clear that business understands that we have a smaller density, business could coexist and address the needs of our community. It's clear that the city of Renton would like to be participatory in the resolution of issues and not have an opinion or a resolution thrust upon us that we do not have the ability to interact with. It's also clear that mental health comes out universally. The notion of other came through loud and clear. The notion of community input and the reduction of fear came through. And with accountability, we need tremendously useful evaluation tools, and leave it to the youth. The young student is the person who had done the research and pointed out at least an initial piece of data that would be very helpful for business to see progress is being made. I think that I have covered a lot of the overriding issues. This population needs to be included in community. Community takes away other. There are things that can be done. And so we have, I see steps, building steps as this is written up to share, and that would have impact on how we address the issues moving forward. The services that need to be provided were identified by the totality of the people here. The ability to listen from both sides, the understanding that there is a misperception misconception about what's going on, and there is data now available to us to show that that misperception is not the multiple reality, and that there are people on the ground floor willing to commit their expertise to help design a paradigm that would help this community. So there's an opportunity here. Not once did I hear from the 5 groups that reported back that there is an opportunity. I heard honest examination of where I'm hurting, but I also heard reflection of there are places that could be tapped so that I don't hurt, and I'm open to that. I think that's the best way to leave this portion of our agenda. Does anyone want to add anything to that? Then I think it's time for the next section. It goes back to Diane and Linda.
So Diane, I'll go first, and then I'll leave the remainder to you. I think in listening to the community today, the one thing that I discern is we all want the same thing. I think the voice of the community is very powerful. I think the solution is found with the community. I believe that it's important for the community to always have a voice in what's going on. And I think you've demonstrated that today. So just, gathering your thoughts and about, what's going on and being part of that solution, I think is very important. So I think in terms of that is what I heard. When we hear just some of the ideas that came out, I think it's noted to note that pretty consistent across all groups. There are ideas of how we can move forward in a healthy way, engaging people, because people that are experiencing homelessness are people. They are part of us. They're not some separate group of people sitting on an island by themselves. And we here as the community are called to come alongside of them with compassionate care, and in that process addressing the needs of the community. We know that we would be naive to think that the issue of homelessness is going to go away. This is something that we have to deal with in our community. We can't turn, just turn a blank eye to it. We have to think about it, move forward in the future. And I'm really encouraged by the compassion. I'm encouraged by ideas and solutions that have come forward today. As always, here in our city, I think when we come together as a group, as a community, we do amazing things. And so thank you for, just those amazing ideas that have come forth today. Diane.
Thank you very much, Dr. Linda. I think the biggest takeaway I have in looking forward is, and hearing from everyone here, is communication and collaboration. And there are definite needs within our Renton community that are there that still need to be met. And that the deintensification facility was put in within an intended purpose. And in accordance with the city zoning practices, it may or may not be the correct location. And there may be locations that are better zoned and appropriate for this type of service. And the implications upon the businesses are very tangible, and we need to be cognizant and respectful of that, while at the same time being incredibly mindful that these are humans and they have very important needs, and mental health being such a huge part of that process. And it is wonderful that Leo was able to join us today. And Leo, I hope that you can take back to the county that the Renton is not a NIMBY approach. And while there are tangible impacts, what we are asking and essentially begging is for an opportunity to be at the table in those discussions with our municipal leaders, with our service providers, with our concerned community members, to be a part of the process. And as King County looks for permanent shelters as part of their process moving forward, it is incredibly important for King County to be mindful that each community has different needs, and it is very important to have the community to be a part of that collaborative process in order to create that supportive environment that can embrace these individuals as we uplift them to their restorative care as well, and embrace them as part of the communities to provide the best approach possible. I am so proud and impressed with the community members that are here and the open-minded approach that they have taken, and the compassionate care, despite many of the impacts, that the compassionate care still rings as a priority. And so Leo, please take that forward as the only representative for King County here, to let them know. And I think that's what I take away, and if I have missed anything, please reach out and we'll compile the information that we have. Those facilitators, we will connect and do a deeper dive into the full conversations that were there, and take the message forward. I have put into the chat that there is an opportunity on December 17th for our next community conversation with the DESC operators as a community, so please feel free to join into that as well, for real-time conversation with Noah Fay or Samantha McKnight, the ones that are there at the facility. Casey, I defer to you.
May I ask one question to Diane before we go to Casey? Is there any way that the group that attended today could have access to our summary, or
Oh, absolutely.
Okay.
Absolutely. What I would say, we will then send out a summary, a written summary, as well as a recording, and we will send these on to the elected officials so they can hear our comments and concerns. Because again, they wanted to be here, and we heard from many elected officials that they wanted to be here, but they could not for the various reasons as expressed. So it is important that we convey that message, but we will send it out to everyone that participated today too.
Thank you.
So in closing, I just want to thank each one of you for your time, for your thoughtfulness, for your willingness to give a few hours on a Saturday to do your civic duty, to be community, to kind of lift up not only where we're at, but maybe where we might move forward around issues of homelessness. And so thank you, each one of you. Job well done today, and know that we care for you and for your voice, and we will make sure that all of your contributions are recorded and are sent on. So again, thank you all. Have a good day. We are just really, really grateful for your presence today. Be well.